Hello and welcome again to Inside INmune Bio. I'm David Moss, co-founder along with RJ Tesi. Thank you, RJ, again for joining us.
Good to be here.
Likewise, it's nice to have you. So today what we thought we'd talk about is specifically some of our biomarker data from our phase 1 trial, and in particular our white and gray matter biomarker metrics, what we call virtual biomarkers, because we really think they're so unique in what we're doing with our clinical development. What gives me such interest and insight and confidence into what we're doing is that we've used, I think, biomarkers from 5 different firms. So we had Imica with the white matter, we had Oxford Brain Diagnostics with the gray matter, Proteome Sciences with some of the proteomics, we had Olink with the cytokine panel, and then we had the Roche Neuro Toolkit. So that's 5 different companies, right? And I think what was so fascinating is all these biomarkers really correlate. They correlate one way or another to show that we're making a change in the brain. And one of the most interesting ones, and something I would really like to see other companies start to use, and maybe they have used, but we haven't seen it yet, is some of this white and gray matter imaging. So maybe what you could do, RJ, is talk a little bit about, first, let's talk about Imica and the white matter imaging. And then second, let's talk a little bit about the gray matter imaging, because we released some recent data over at AAIC, and what that means with regards to our confidence level and what we're doing moving forward with our phase 2 trial.
Yeah, so thanks, David. Let me first help everyone make sure we're on the same page with what a biomarker is. A biomarker is something that allows you to measure something about the disease, and it can be a blood test, it can be a X-ray, it can be a piece of tissue, or in our case, it can be an MRI scan, MRI DTI, which is a very powerful technology, which is really revolutionizing the drug development for CNS drugs. And the reason are threefold. First of all, when you take an MRI, at least the way we do it, and I'll get that in a moment, it tells you how bad the disease is. Secondly, when you give the patient the drug, you can watch the brain change. In other words, see what the drug does. And finally, you're able to correlate those changes with the clinical output, which in this case is cognition. We're talking about Alzheimer's disease. And so the cognitive function is really what everyone is that's what patients ask, am I going to stop getting worse? And that's the cognitive function. So it turns out that the brain has 2 parts, white and gray matter. And you can't do brain biopsies like you can if you have a tumor. You can stick a tumor with a needle, and you can take a little piece and look at it under the microscope. You can't do that with the brain. You can't do brain biopsies. So you're dependent on things that are kind of circling. They're outside the brain trying to figure out what's going on. You're from the outside looking in. The MRIs allow us to do what we call a virtual biopsy, and this is what's incredibly powerful. We started with white matter analytics. The white matter is the part of the brain which really has the superhighways of the brain. And it turns out the white matter, people used to think the white matter was kind of this boring set of telephone lines, right? It was basically, that's not where the action was, because the action was in the gray matter where the nerve cells are. Turns out there's a lot going on in the white matter. The white matter allows us to look very well at 3 things. Neuroinflammation. Immune bio is all about neuroinflammation. We can measure that with white matter-free water. We can look at axonal quality, and that means we can check and make sure the wires are intact and healthy. And then we can also look at myelin quality, or remyelination, demyelination. Myelin is the insulation around the wire. So basically, we have 3 metrics: white matter-free water, axonal function, and myelin quality, that allows us to see what's going on in the white matter.
So in the white matter, thank you for that explanation, what is it that we saw when we treated our phase 1 patients with XPro?
So first of all, we selected patients that had neuroinflammation, and what we saw was they had very high levels of white matter-free water, so they had lots of neuroinflammation. So we could see that. clot. We could see that edema in the white matter tracts. And then when we treated them with XPro, over 3, 6, and 12 months, you could watch that white matter free water disappear. Excuse me, the pathology of neuroinflammation as measured by white matter free water disappeared. And to our surprise and delight, when you get rid of inflammation, axonal quality improves and remyelination improves. So the two other measures are parent fiber density and RDT. They all showed benefit. So we were delighted, and this is early on, and we just had, we suddenly had a tool that allowed us non-invasively to look as often as we wanted to see how the patient was doing in responding to the drug. But people would ask, well, that's cool, that's white matter. But, I always thought Alzheimer's was a disease of the brain matter. That's gray matter. That's where the smarts are. People have your mother's birthdays in the gray matter, and they're right. So we worked with another group, and we actually have developed, and that's what we just presented at AIC 2023 in Amsterdam, is we have equivalently powerful analytics in the gray matter. And we're looking specifically at the area of the gray matter where the white matter and the gray matter come together, because that's where all the action is for both Alzheimer's and, it turns out, MS, which is another important disease where these studies become important. But there we showed that not only was in our patients was the microarchitecture or the cells of the brain were structurally poorly aligned, but most of this pathology was occurring in the parts of the brain that suffer from Alzheimer's the most, mainly the cingulum. So in fact, once again, we have a non-invasive test that allows us to hone in on the part of the brain where the disease is. We can see how much the patient has. We can watch it change while they're getting the drug. And then we can correlate those changes with cognitive function. So suddenly we have this virtual biopsy. And I can't tell you how important this is for not only for the development of XPro, but for the development of XPro for diseases beyond Alzheimer's disease. As I mentioned, MS is the first one that comes to mind.
So we see changes in both white and gray matter for patients that had Alzheimer's disease with elevated levels of neuroinflammation that improved. Why is it? This is a biomarker most people have never heard of. We're really educating the space on white and gray matter MRI imaging, especially as it relates to during a clinical trial. Why is it that we don't see this in other Alzheimer's trials?
Yeah, I think it's kind of simple, and it really goes back to what you've heard me talk about before, which is groupthink. Everyone was completely convinced that Alzheimer's was all about amyloid and tau. So they developed very sophisticated techniques to measure amyloid and tau in the blood, in the CSF. Once again, you can't do brain biopsies, but they could use PET scans, which is a nuclear medicine technique, to look at the amount of amyloid and tau you had. So they were completely focused on amyloid and tau. And it turns out we now know that amyloid and tau play a supporting role. They may not be the only pathology that's going on in Alzheimer's disease. So quite frankly, people didn't care until they found out that the results of getting rid of amyloid and tau weren't that exciting. And now they're beginning to say, ooh, we need to look in other ways. We need to look at the problem differently. And I predict in the future, everyone's going to be using these technologies. It's just we're way ahead of everybody. And what I like to say is, when it comes to biomarkers, Immune Bio is playing chess and everyone else is playing checkers.
So in our phase 1 trial, we saw both improvements from the MRI metrics in white matter quality and gray matter quality using the two different companies that measured it, both Imica and Oxford Brain Diagnostics. And these biomarkers are new to people. Which I think when people hear about new biomarkers, it's a learning curve and they're not comfortable with them yet. Why is it that we don't see this with other companies running clinical trials or we haven't seen published results? Why do you think that is?
So I think there's two things going on. One is this traditional focus on amyloid and tau, which, you can argue has really been misplaced. But I think the more interesting question is why we haven't seen it is really we're not sure. I mean, we think these are really powerful biomarkers. We suspect other companies are looking, but we've not seen the results from their explorations. And it either means they aren't having an effect on these structural elements, they are unable to really do a virtual biopsy, or, they haven't looked yet.
Yeah. I think one last comment, and then we'll end it, is we know that there's brain atrophy and shrinking, obviously, from the anti-amyloid drugs. And we saw that difference with our phase 1 patients. And so obviously, I guess the logic would be is if you see shrinking, then your white and gray matter is certainly not improving, right?
That's the conclusion. There was a lot of discussion about this at the AAIC. I mean, and Alzheimer's disease professionals are really concerned that the anti-amyloid drugs don't show a change in the trajectory of brain shrinkage, which is one of the hallmarks of Alzheimer's disease and dementia. I think if you're remodeling and repairing the brain, you would expect it certainly to remain stable and maybe to go back towards normal. And that's, although in a small number of patients and part of the brain that suffers most from Alzheimer's, called the temporal lobe, we actually saw an increase in volume of the brain that has never been seen before. And we think good things can be happening.
Great. Thank you so much, RJ, for explaining that. Very helpful. And again, please share the video, and if we get 25 comments, I know it's a big ask, we'll pick a random comment and mail you a nice hat. Thank you very much.